Hello everyone, this is Dr. Janaki. I am the consultant dermatologist and cosmetic physician at KIMS Hospitals, Kondapur. Today I will be talking to you about psoriasis. Psoriasis is a chronic inflammatory skin condition which is very commonly seen outside as well as in our OPDs. So psoriasis is a chronic, meaning it is a disease that lasts for a very long time and it can start at any age. It is a chronic inflammatory skin condition, so which means that it is red, angry and itchy. So what exactly is psoriasis and how it can affect people, and we will talk about what management is available. So what is psoriasis? Psoriasis is basically an overgrowth of the top layer of skin cells. The skin is made up of different layers and the topmost layer is called the stratum corneum, and it is made up of multiple layers of cells. These cells in psoriatic patients tend to shed faster, which causes flaking of the skin and a buildup. There are different types of psoriasis depending on the area of involvement and the degree of involvement. The most commonly seen type of psoriasis is scalp psoriasis, where you develop red scaly plaques or dandruff-like lesions on your scalp. The other commonly seen psoriasis are palmoplantar psoriasis, which commonly involves the palms and the soles of our feet. It appears as dry, fissured feet with deep cracks. And then the other types of psoriasis which are seen are pustular psoriasis, which can be seen on the palms and the soles. Inverse psoriasis, which can involve rarely involved areas like the folds of your skin, groin, under the breast areas and armpits. The most common type of psoriasis is plaque type of psoriasis, where multiple plaques of psoriatic patches are seen on multiple areas of the body. Another type of psoriasis is guttate type of psoriasis, where small raindrop type of appearance is seen on the back and on the front of the chest. Psoriasis also tends to involve the nails, making them thick and causing certain amount of flaking on them. When it involves the joints, it can lead to joint pains. This is known as psoriatic arthritis and is an often overlooked symptom. These patients complain of joint pains and have pain on involving multiple joints. Psoriasis in scientific terms is an autoimmune T-cell mediated disease, which in other words means it is genetic, it runs in your genes and it comes out when exposed to certain triggers. Common triggers for psoriasis are stress, any sort of physical injury, trauma, exposure to certain medications or viral infections, and burns or even an extreme sunburn can sometimes trigger psoriasis and bring out the symptoms in a susceptible person. Psoriasis tends to increase when exposed to certain triggers. Commonly seen triggers are smoking, stress, exposure to certain drugs, stoppage of certain drugs like steroids, infections, warm weather, really warm weather or cold and dry weather, and physical trauma. Now we will talk about the management of psoriasis. The first step in management of psoriasis is first getting your diagnosis, for which we do a thorough examination of your skin, hair and nails, after which sometimes some patients might require a biopsy, which is where we take a small piece of your skin and send it for examination. After the diagnosis, different types of treatments are offered to patients depending on the severity of the psoriasis. The most commonly given treatment is topical treatments, first out of which is moisturizers. The moisturizers form the first line of treatment for psoriasis, after which we use a multitude of creams like steroids, calcineurin inhibitors, vitamin D analogs, coal tar based creams and various other humectants. Various oral drugs are also available now in the market to help treat psoriasis. These help in faster resolvement of symptoms and give you more disease-free periods. The most interesting and new innovation that has been found in the field of psoriasis is biologics, which are excellent injections which are now available in the market and can give you disease-free periods almost up to 6 months to 1 year. Reach out on the MFine app to a certified dermatologist to find the correct solution to your problems.